I was very skeptical when I started. My wound surgeon referred me here, and both my wound surgeon and my infectious disease doctor said that it facilitated the healing of the wounds in my feet dramatically, expediting the healing. And right now, one of my wounds is completely healed, and the other wound is showing tremendous progress. I come from a medical field, and I did not know about hyperbaric until my wound surgeon referred me here. In fact, when I got here, it was a question because of my medical history whether I was a good candidate, and I had to be referred to other physicians to evaluate me who knew nothing about hyperbarics. I think my experience is that this should be promoted much more by educating doctors on how the therapy is so useful, and to have insurance companies be more receptive to their coverage.
I take care of patients with complex wounds involving trauma, and also in multiple diseases like diabetes and venous insufficiency. So I take care of those major wounds and until they heal. I mainly receive complex patients. I use modalities like hyperbaric therapy for management of those complex wounds. I take care of venous ulcers and diabetic foot ulcers that have mainly been for many years in patients, and we are very aggressive into graft them, and most of those patients will require the use of hyperbaric therapy so they can close. I have good results with the patients, principally with those patients of wounds that have developed infections in the bones, osteomyelitis, and patients also that have vascular problems with vascular insufficiency, ischemic wounds. A patient we graft, and the graft from the first days have some problems of attachments, so we can provide hyperbaric therapy to increase their chances of healing. I will recommend hyperbaric therapy to all my colleagues. I think that the hyperbaric therapy had been not used as it should be used, principally in patients that are chronic wounds that they are not healing by conventional therapy. They're lacking of, I believe, of knowledge of colleagues to use hyperbaric therapy. For me, is alarming. They should be using it more frequently, and I have a great experience in wound care, and since I start opening relationship and sending patients to this hyperbaric center, the wound care results of my patients have improved dramatically.